So Dr. Seguerra, you can unmute yourself. Maybe you can say hello and yes, greet everyone.
Hello. Hi there, I'm fixing my camera.
Don't worry. Thank you so much, Dr. Seguerra, for really being with us right now.
Yeah, it's an honor. It's a pleasure to be with you. I'm
Wow.
always excited when it comes to sharing.
Wow, that's really great. So,
Yeah.
Dr. Seguerra, we have Filipinos and also I believe we have some foreigners. I mean, our international family here. So I'm trying to, so I can, okay, I can spotlight there. Okay. Yes. So I have pinned you, Dr. Seguerra. Okay.
Okay.
Is this a raise of hand, Miss Jennifer? Is this a raise of hand, Miss Jennifer Sikora? Yes. Okay. Yes. Miss Jennifer, are you raising your hand for question?
Hello, Timmy.
Ano mo na kasi kaya na mati.
Oh.
Hello,
Okay.
Timmy.
Who's that? Yes. Yes, Doc.
While everyone is still thinking of what question to ask, maybe I would tell my story.
Okay, that would be great. That would be
Yeah.
great. Yes.
Okay, so it started off when I got hold of my first device, actually. So I immediately used it. And then when I had been using it for from October to, let me see, when I had been using it for about 8 to 9 months, that was when I had my executive checkup. So I just listed down, since I'm a physician, I just listed down the laboratory exams that I wanted on me and presented myself to the diagnostic laboratory, and they got my blood sample. And when I got the results, I was surprised that my hemoglobin A1C, that's a test for diabetes, it's a retroactive determination over the last 3 months of your sugar level. The normal hemoglobin A1C is 5.7 or less percent. And I got mine at 8. So for the first time last year, that was last year around August or September, I realized that I was a diabetic. And since I had been using the device for 8 months previous, I was thinking that maybe it could have been worse if I had my determination before I started using the iTeracare device. So in September, I had a hemoglobin A1C of 8. And of course, I was scared because diabetes is a very scary disease. And I I prescribed myself with some anti-diabetic medications, but it only made me feel very weak, as if I lost energy and all my muscles were aching. So I discontinued taking those medications because it had uh, a bad it had a very bad side effect on me. And I just continued using my iTeracare device every night, especially on the feet and on the palms. Sometimes I am so busy, I couldn't blow all over my body. So I just concentrate on the hands and on the feet, especially on the palm of the hand. And that was in September. And at the same time, I started to change my lifestyle. I love to eat, ice cream. I love to drink soda. So immediately I deleted all those things in my diet, and I really started on a lifestyle change, and with only the iTeracare device, that was my form of intervention, which I had been blowing on myself, not sometimes, not even regularly. So today is now January. Um, wait. So when I started removing my medications, and I was now on full iTeracare device therapy, I also started monitoring my blood sugar on a daily basis. Of course, it was high at first, but since the month of August, September, October, November, December, and January, having removed my medication with only the iTeracare device that I had been blowing on myself, and drinking the energized water of iTeracare, I am happy to conclude that for the last 90 days, my blood sugar has been on the normal level.
Yes,
So,
yes, yes.
on my personal experience, I can say that we can be removed of any medication
Wow.
that we are on at the time that we start using the iTeracare device, and I have proved it on myself.
Yes, thank you so much, Dr. Seguerra. I think we have already some initial questions, if you're
Okay.
ready, Doc. Yes.
Mhm.
First, of course, I know this might be, but I'll be reading from the chat. It says that it is term therapy. Does it need to be applied every day? How many times?
The
From Miss Arlene.
Yeah, the recommendation is when you start using the iTeracare device, you start it gradually.
Okay.
Maybe you start for 15 minutes. And by the way, there is a guide for blowing
That's
yourself.
right.
We
That's
have
right.
a
That's right.
we have a guide on how we will blow ourselves with the device. And it's better if you do it personally, not having another person do it on you. Because you know better where your aches and your discomforts
Right.
are, and and it is preferred that you blow on them directly. So the recommendation is you start at 15 minutes on day one exposure, then on the next day increase the time 20 minutes, and then the next day 25, until you can tolerate the 2-hour exposure that is allowed for the terahertz energy.
Wow, that's very important. So to recap, we start 15 minutes until maximum 2 hours, which is the allowed one.
Yeah,
thank you so much, Doc. So I
but
believe
even if you go beyond 2 hours, there is really no harm, because
that's right. That's right.
the energy is non-ionizing.
Right, right. It's just like the recommendation because it's heat, right? Thank you, Doc. Yes.
And besides, the reason why it is recommended that you start slow, because the iTerahertz energy will start to detoxify your body.
That's right.
And detoxification can be very painful. And we don't want you to go through that.
Oh, yes. That's really a great insight. Thank you, Doc. Now from Jonart Mayo, can we help myoma patients with iTeracare products? Subject for myoma operation?
Okay. I had been doing a lot of research. In fact, I have my tablet with me. I have been doing a lot of research about the medical applications of the terahertz energy, which is in our device. And it is really good for tumors, for cancers,
Wow.
for almost everything.
Wow.
Skin cancer. Let me see, I have a list here.
Including COVID
I had
survivor.
been doing review of literature,
Wow.
of papers that have discussed the medical and the diagnostic and medical applications of the terahertz energy.
Wow.
So it is really good for, let me see, I have just been writing this the other day, for breast, for skin, for the mouth, for the cervix, for the lungs, for the small
Wow.
intestine, for the prostate, for the colon, for stomach cancers, for tooth decay, for diabetes, for
Amazing.
emotional, psychological states, evaluation of corneal water, to diagnose visual diseases. And you know, myoma is a kind of tumor,
Mm-hmm.
and terahertz energy can work in that.
Wow, that's great.
Yes.
Having said that, because she has so I think is it Miss or Sir John Art? So that means it can help, definitely COVID survivor, sir or ma'am. Now, we have here Don Ojeda. I am assuming he's a sir. What approach or application for people who are undergoing dialysis and chemo? What approach?
Actually, you just blow it on your body.
Okay. Is there a specific area, Doc?
In dialysis, people get to have the recommended with dialysis because the kidneys are not working. So you can blow over the kidneys.
Okay. So we heard that we can blow directly to the kidneys.
Yeah,
Now,
and
amazing.
don't forget that the energized water.
Yes. So to
Energized
charge the water, and then of course for drinking. It says, Miss Irene, how do you want? So I believe this was answered, Miss Irene. So we start with 15 minutes. Yeah. So, and also, Miss Marie, can it help a patient with mental disturbance? So I believe you already mentioned it can help the emotional, right?
Yes.
Emotional and
Yes.
yeah. So wow, this is really.
And there is also one thing that I have been experimenting on. And I think it gave me positive results with my hypothesis. You see, we have this area in our brain, the prefrontal cortex. It is on the right side of your forehead. That is the center for short and long-term memory.
Wow.
There is a paper that I have come across that if you expose that area with laser heat, coming any laser heat for that matter, and we have an advantage because we have the heat that is generated from our device contains terahertz energy.
Wow, amazing.
So if you focus it, blow it over your right forehead.
Right forehead, okay.
It will increase your memory. It will improve your memory by 25%. So I have done this experiment in one of our leaders in the office here in Cebu, and it was just amazing.
Wow.
Yeah, I don't think I have to go through the what we did because it was something. No, there had been a lot of details, but
Wow.
to make a long story short, you just have to blow over your right forehead.
Wow. So blow over the right forehead. So I will do that.
Yes, and I have been doing that myself.
Okay.
And it
Thank
has
you.
really, I could really feel
Thank you, Doc.
the improvement of memory.
So we have from is it Sir or Ma'am Indira? How would you want the breast cancer patient? How many times a day and how long?
You still have the 2-hour maximum exposure.
Okay.
So you
2
can
hours.
divide the 2 hours into 30 minutes. It's really all up to you.
So
You
with
can
her,
go
with
30
the
minutes or just 45, however.
Oh, okay. So 30 or 45. So she or he, Miss Indira, is it Miss Indira, has a follow-up question. Is there a recommended time of the day to blow to maximize its effect? Is it
No.
the same? Okay, none. Okay, so it really depends on the situation.
Yes.
Oh, okay. That's really great. And then how to blow on tumors in head?
Well, in energy medicine, there is a way of blowing, no? The direction in blowing. When you do the counterclockwise direction of blowing, it's like opening the lid of a container with a
Wow.
cover, no? That's counterclockwise direction. If you blow counterclockwise direction, it means you are removing the blockages, the energy blockages that are along that area. So after you have removed the blockages, you have to energize it because it has been cleaned out. You have to energize it by blowing on the clockwise direction. So it's like closing the lid.
Oh, so it's like counterclockwise for the
Yes,
blockages,
first to
and then
remove the
first,
blockages,
and then now the clockwise.
clockwise. Maybe you can do counterclockwise for 2 minutes,
Okay.
3 minutes, and then go back to doing the clockwise direction for another 2 or 3 minutes.
Wow, that's really so helpful, Doc. Thank you so much. And of course, because of that, Doc, we have a question, of course, from our amazing partner, our upline leader, Miss Faith. May we have the number? May we have your number for further professional consultation, Doc?
Yes, fortunately, I have created a Facebook page
Oh, that's really
for
great.
our iTeracare.
Which they can message for
Yes, it's
consultation.
named iTeracare Subu.
iTeracare. Okay, so we will be
Sugbo.
typing it. iTeracare Sugbo.
Yeah, you can look it up.
Is this a right spelling, Doc? Yeah,
I
Sugbo,
created
like
only yesterday. And then Sugbo is the ancient name of Cebu.
okay. That's
Before
SUGBO, Doc, is it?
SUGBU.
Oh, you. Okay, sorry,
Iteracare
this is
Sugbo.
wrong.
So you can interact with that page. I have a cell number there,
Wow,
and you can put in your questions,
that's really great. Thank you so much, Doc.
and I will always answer.
Wow.
It's
Doc,
always open.
okay, sorry, Doc. Just to repeat, SUGBU.
Yeah, iTeracare Sugbo.
Okay, there you go. So this is for professional, because we have cases where there's several, that's right, experience of bleeding and all that. So this is really really helpful. And of course, now we're so that we will not keep you so much, Doc. But before that, I think we have a question. So maybe you would have one testimony, Doc. We have from LP. I don't know who's LP, sir or ma'am. Good evening, Doctora. Do we have any testimonies for hyperthyroidism or even hypothyroidism?
Okay.
Hypothyroidism.
I have a younger sister. She works abroad. And then sometime in September last year, she called me up and she told me that she was scheduled for an operation on her goiter. She had hyperthyroidism. I advised her against it. And I told her that, wait, let us see how this iTeracare device will help. So we sent her a device, and it was so expensive sending it. It was to Europe. We paid about 8,000 pesos for its freight. But anyway, after a month, 2, 3 months of blowing over her enlarged neck, which had goiter in it, the mass has reduced in size to almost even half. And now she is even feeling better than she used to be. Her
Okay.
condition
Wow.
has improved. Although the mass is still there, but it's getting smaller by the month.
Oh, wow. So there we go. We have, thank you so much. It's so good because it's a direct testimony. Okay. Now, Doc, I think we have last 5 more so that we won't
Okay.
keep, because now we have, we have already your page so that we can. Just to confirm from Miss Julia, I believe, do we always have to blow meridian points first, or can we just focus on problem area?
You can do either both, or you can do them together.
Mhm.
I have studied energy medicine, and we were doing meridian clearings. So, but when you really have a problem area, you can immediately go there and remove the pain.
Okay. So basically it depends. It's not
Yes.
really like it's not, or
There
but
is
it's just
no
recommendation.
strict sequence of doing
Okay.
things.
Okay. So it's just more on basically depends on the situation.
Yeah.
And then it okay, thank you, Doc. From Lois, I have been reading testimonials regarding, is this tinnitus? Tinnitus?
Tinnitus.
Oh, tinnitus, but
Yes.
still not convinced if it really works. So what can you say, Doc?
Tinnitus means there is a ringing in the ear.
Mm-hmm.
It could either be due to an internal ear problem,
Okay.
or there is a problem in the central portion, which is in the brain.
Oh.
The my advice there is to blow with our laser focus, the blue light, diba? We have a blue light
Yeah.
over the mastoid
Okay, here.
at the
Okay.
back of the ear.
Okay.
There is a bone, if you would feel that.
Okay.
Blow over that area.
Okay. So there we go. We
Yeah.
blow that
On
area.
both sides. Even if
Okay.
it's only one ear that's ringing, just do both sides.
Both sides.
for
Okay.
balance.
So both sides at the back of the ear. Okay. Thank you, Doc.
Mhm.
Hi, Doc, from MKB. Can we use the iTeracare for facial cellulitis?
Yes, unless there is an open wound, you have to cure that wound first.
Okay, so again, the standard, because open when we have to really that's part of the disclaimer
Wait
of
for
our
it
device.
to heal
Okay,
first.
so there you go, sir or ma'am. MKB from Jaime. I'm sure he's a sir. I have a cardiovascular disease. Can iTeracare be helpful to my medical condition?
Yes, of course.
Wow.
Just blow over the heart. It is underneath your breastbone,
Breastbone. Okay.
underneath the sternum.
So, sir, we heard that. Yes, definitely. Jacqueline, hi, Dr. Seguerra. My sister have been observing herself that whenever her skin is being contact with electrical devices like hair blower, electrical blanket, she developed allergies in area being exposed. With iTeracare, she is still experiencing the same, like she blew it in her eyes and allergies appeared around her eyes. What is your opinion about this?
iTeracare is supposed to be non-ionizing, and it is supposed to be safe. Maybe she still has those reactions carried over her previous conditions.
Oh, okay.
So just go ahead and blow it with
Continue.
iTeracare.
Okay.
Yeah, you know, when you use energy in energy medicine, we have this thing called healing crisis.
Mm-hmm.
It means that things will get worse first before they start to heal. So don't stop. The body is doing its job. The body is doing its cleansing. Just support it by blowing yourself with the iTeracare, which
Continuously.
has the terahertz energy in it.
Wow. Yes. So there we go. We will continue. From Cherry Lou, Doc, thank you. iTeracare can treat bunion. Is this bunion, Doc?
Yeah, bunion is a kind of an inflammation on the joints. It's similar to gout.
So,
So
yes, it can treat.
just go ahead. Just go ahead and blow over that area.
Okay, so we blow that area. Almost heaven. Wow, ganda namang name. Can we use the device on a patient who just had an open surgery? Where to blow and how long?
When someone has surgery, it will take about a week for the wounds to heal. So when the wounds on the skin are healed, it means the structures inside the body have already healed. So that's
Okay.
when you may use to blow yourself with the device, but not immediately after.
Okay, so there we go. And from Sir Alan, is this Sir Alan? Hi, Doc, can we use iTeracare for scoliosis?
In scoliosis, your bones have really gotten their curved. We can only ease the pain.
Okay, so we can ease the pain. Okay, thank you, Doc. From Sir Nestor, hello po, Doc. Paano po blow breast cancer with sugat na po? So there's already wound.
Just blow over the area that do not have the wound, the surrounding area. Blow over the surrounding area. In breast cancer, there comes to a point that there will be an ulcer already on the breast. So there is an open wound, but you can blow around the area. Just don't hit the open wound.
Okay, so blow around the area. Okay, so sir, there's your answer. Oh, so she's a ma'am, Mrs. Ma'am Indira. I'm sorry to have a lot of questions because we're trying to share these amazing products. Sabi niya po, Doc. She said, can I ask how to deal with my very bad detox or healing crisis? My friend is still very unwell after using iTeracare and drinking charged water. So is this the same what you were saying, Doc? Continue lang kasi it's healing process?
When you are really detoxing, you might need medical intervention actually. But it is not a permanent condition. It is the body just going through a painful process while it is cleaning up. In my case, when I first got my device, I immediately used it because I already have, before I got the device, I have already known about its benefits. So when I got hold of it, I immediately used it and for an hour. And the next morning, because I used it at nighttime, the next morning, I woke up with a headache and my blood pressure was very high. So if I was not a doctor, I would have rushed to the emergency room of the nearest hospital. So I just treated myself with drugs for hypertension. I went back to sleep. I must have slept about half an hour, and when I woke up, I felt better already.
Okay. So basically,
So call for help.
Call for help.
You feel really, really bad.
Okay.
Call for help.
So thank you very much, Doc. May I just finish? So we will end with Sir Dante J. Navarro. Ladies and gentlemen, to everyone, our Pride family, I'm really sorry, but we can just go straight to her page. But we will I will just finish until the last for Sir Dante. Tapusin ko lang, Doc, Dante J. Navarro. Okay po?
Okay.
Yes, so that, I mean, I'm also telling everyone because questions just keep coming and because it's really helpful. Thank you so much, Doc.
Yeah.
Okay, next is, that's the heart. Okay, scoliosis we already. And okay, hello, Doc, from Miss Hilda. I believe this is Miss. How about epilepsy, Doc?
For epilepsy, you really need medical intervention. But in energy medicine, in advanced energy medicine, if you know the process, you can really stop seizures
Wow.
even without drugs.
Okay.
There is a way of doing it, but for amateurs and for those who are not, you have not studied advanced energy medicine, just call for help. Just call for your medical practitioner to intervene in the seizure.
Okay, so basically, Doc, it's really up to the person, right?
Yes.
Okay, thank you, Doc. Miss Maria, my husband has a rare blood disorder called points. Can iTeracare help him? Points?
What?
POEMS.
PO.
EMS. Is this right, Miss Maria? Would you want to? Okay, let's get back to that, Miss Maria. If we can clarify.
Yeah.
Okay. We'll go back to that. Miss Ida, Happy New Year. My 79-year-old auntie is advised to undergo brain operation because of blood clots due to accident. Is it okay to blow her head directly?
After the operation.
Oh, okay. So Miss Ida, it will be after the operation.
Yeah.
Yes.
But wait for the wound to heal.
Okay, so we will wait for the wound to heal. From Miss Gida, how about for cross-eyed, Doc?
Cross-eyed, they would need a surgical intervention.
Oh, okay. Okay. So thank you, Doc. Almost done. I think last three. My friend's husband is not very keen for my friend to use it as of now, as he had seen that her asthma flared very badly. So does that mean it's part of, what can you say about this, Doc?
I think it is, if they had been using the iTeracare device and the asthma still flared, I believe it's a detoxification process. I have been a severe asthmatic myself, and when I started using the iTeracare device, I didn't feel an immediate relief, but over the months, at about 6 months, 6 months using the iTeracare, and up to this time, which is now about 1 year and 3 months, I have noticed that my medications for asthma have already expired and I haven't used them anymore.
Oh, wow. So in short, it can help, Doc.
It can help, yeah, just be patient. The
Just be
body is trying to do its work.
Okay, so Miss Indira, there you go. Okay, from Sir Dante. So I think this is last three, Doc. Good evening, Doc. Can I apply a TheraCare device to my son who has been suffering from epilepsy since he was 9 years old and he is now 32 years old and still suffering and experiencing his illness? So I think this is what you were mentioning, Doc, for the seizure, right?
Oh, if he is having a seizure, don't use the iTeracare. But
Okay.
if he has no seizures, then you can blow on him the terahertz energy.
So there you go. Is this Sir? I think Sir Dante. We can use it as long as there's no seizure, and continue to have the iTeracare being blown on him. Good evening. I have hyperthyroid. This is Miss Aiza. and been using iTeracare. Hope it will help like what it did to my patient who was so weak and was unable to walk. And after blowing for 2 to 3 weeks now, he is able to sit and stand on his own. So I think she's sharing that. So I think she just wants a confirmation that it can help her, right, Doc?
Yeah.
Okay, so it will help Miss Aiza. Yes. So, okay, I think okay, I skipped it. Thank you, Miss Faith. My wife has a nodules in lungs. Is it proper to blow at the back or front?
You can do both, either on the front or on the back.
Okay, there you go. Whoever asked about the nodules, either back or front. Okay, this is our last question, finally. For asthmatic kid from Lagrima's phone, okay, how long can we use the blower for asthmatic kid?
The same as adults.
Oh, okay. So the same as adults. Okay, so there we go. The same as adult. So may humabol, the last one, is it okay to blow after sprain?
After sprain, yes. Yes.
So it's okay. So after sprain. Okay, talagang humahabol pa, Doc. Sorry, dalawa na lang, please po. Okay, but sige.
It's okay.
Almost heaven. Can we use a device on someone who have metal implant? I think, yeah.
No,
This
no,
was part
please.
of the disclaimer.
Only on other parts of the body that do not have the implant.
Okay, so other parts of the body that has no implant. So there you go, ma'am or sir, almost heaven. And of course, Sir Alan Ko, where to blow with peripheral vertigo?
At the back of the ear.
Same, okay, at the back of the ear.
Yes.
Okay, so there you go. Thank you so much, Doc. It's really, there, yung tinanong natin kanina, Doc, talagang last na Point syndrome. Point syndrome daw po.
Point syndrome.
Opo. Point syndrome. Will it help? Rare blood disorder called Poems syndrome. It's POEMS syndrome.
Okay, it's
Blood
nerves
rare
that
blood
affects other parts of your body. You know, the iTeracare, the terahertz energy in our device is best for the nervous system.
Okay.
In Poems syndrome, it is the nerves that are affected.
So in short, Doc,
you can blow yourself all over.
Wow. So there, it can help. And we're so blessed. We really bless God. Me personally, I really bless God for this wonderful gift. Thank you so much, Doc, for really being with us and having this patient to answer everybody. And marami pong salamat. And also for our guests who are international, globally, thank you so much for listening. And till then,